ensures you are not just prepared but empowered to excel. Let's begin this journey of preparation, performance, and prosperity. And now I would like to introduce the speaker of session, Dr. Vijaykumar Babu Chavadi, sir, MD in Ayurveda, currently is professor and H.O.D, Department of Rasashastra and Bhaishajyakalpana, MRN Ayurvedic Medical College Hospital and Research Center, Bagalkot. Chief Physician at Arogya Vijaya Ayurvedic Clinic since 2008 in Bagalkot. Sir began his UG studies at BVVS Ayurvedic Medical College, Bagalkot. He was the first UG scholar from his college to secure MD seat, completed MD in Rasashastra from DGM Ayurveda Medical College Hospital and Research Center, Gadak. Started his academic journey as a lecturer in 2011. Sir has published 20 articles, guided more than 10 postgraduate scholars, and presented 25 scientific papers at various international and national seminars. Some of his notable achievements include guiding a poster presentation on osteoporosis titled Prevention is Better Than Cure, which won first place at the National Conference Dharana 2014 and winning the best oral paper presentation for his work on conceptual approach towards Vyastapana in relation with Abhraka Bhasma at the International Pre-Conference Jaitra 2021. Sir served as organizing secretarial for the state level orientation program for teachers on review of course curriculum for second professional BAMS 2023 and 2024 on Rasashastra evam Bhaishajya Kalpana implemented by NCISM New Delhi. Sir was chairperson at Kriya Arohana 2023, a national forum discussing the clinical significance of Prakriti and Nadi in a global content, and at Sharira Chaitanya 2024, a national conference on neuroanatomy and neurophysiology, chief organizing secretary of Paripurna 2024. Sir has written Kannada article for newspaper on topics such as the importance of sports in life and benefits of exercise for children, physical health and well-being. He has also appeared in television program including 8 episodes of Sanskriti on Digvijaya 24 into 7 news channel. Sir has received research grant from RGHS Bangalore for project and antimicrobial activities including an in vitro study of Vruna Thaila for the year 2019-2020 and a pharmaceutical, analytical and in vitro antimicrobial study of Vyagri Churna for 2024-2025. Additionally, Sir has appointed as NCISM observer for year 2024 and 2025. Thank you. Now, I like to hand over the Sir.
Thank you very much, madam, for the wonderful introduction. First of all, Om Guru Pyo Namaha, saluting to all the dear teachers and seeking the blessings of Lord Dhanvantari. Let us begin with the exam orientation lecture series for the second professional BAMS students. That too in concern with the Rasashastra and Bhaishajyakalpana subject, paper 2. That is Ayurvedic Aushadhi Prayoga Vidyana. As per the competency-based Ayurvedic medical curriculum, according to the new NCSM syllabus. So today, what we are going to discuss. So as it has been said that, as per the competency-based Ayurveda medical curriculum, according to new NCSM syllabus, the paper 2, that is Ayurveda Aushadhi Prayoga Vidyana, is having certain syllabus points like Aushadhi Prayoga Vidyana, which is going to be asked there in the exam for 5 marks, and out of which the MCQs and SCQs and LAQs, like the one MCQ is going to be asked and one short answer question, and there is no any long answer question from the syllabus point number 1 there in the paper number 2. And the second syllabus point, that is a single drug, the herbal and mineral. So where in which there are total 10 marks are going to ask for the examination, and out of which 2 questions will be there from the side of MCQs, and short answer questions will be of 1, and long answer question is maybe going to be asked as a 1. And this is also going to be there, concern for the theory, practical as well as Viva, and the essay writing, that is the LAQ, long answer question that is going to be asked. And the third syllabus point is the single drug, that is Bhasma, the Shuddha, Dravya, and the Pishti, where the 15 marks are there allotted for this topic and syllabus point, and out of which 4 probable questions are there for the MCQs, and 1 is there for the SAQ, and LAQ is also going to be asked as a 1, and this point is also being there for the theory, practical Viva, as well as the essay writing. And the 4th syllabus point, that is Aushadhi Kalpa 1, where the compound formulations, out of which the 15 marks are allotted for the examination, the MCQs are going to be asked as a 4, and SAQ short answer questions for 5 marks as a 1, and 10 marks, that is long answer question, as a 1. And the same way, the 5th Aushadhi Kalpa, that is Aushadhi Kalpa 2, the 5th syllabus point, that is also been allotted as 15 marks and 4 MCQs, 1 SAQ, and 1 LAQ. And the 8th point, that is Anupana Prayoga for the Aushadhi Kalpa, is allotted with the 5 marks, where 1 MCQ is going to be asked, otherwise that is being going to be asked directly for the SAQ for 5 marks. So there are 45 plus total of 65 marks of Aushadhi Prayoga Vidyana I am going to deal with today now. So the first one, where Aushadhi Prayoga Vidyana, where 5 marks are allotted, MCQ and the SAQ for. So in this, what you need to be remember and execute then in examination is the definition, like Osho Nama Rasaha Swasyam Dhyate Yantadaushadhihi Aushadharogyam Adatte Tasmad Aushadaha. There from the Kashyapa Samhita, Aushadha refers to the substance that bear the Osha, also known as the Rasa, which leads to the Arogya. Aushadhi and Aushadhi are the synonyms. In general, the Aushadha means the preparations made from the drugs to cure the diseases and to promote the good health. And there in the Shabda Kalpadruma, we have the another quotation like Rogabhayam Jaititi Bhaishajam, Bhaisham Rogam Jaititi Aushadam Ityamaraha. So that's what Bhaishajya and Bhaishajya refers to the substance or the instruments or the treatments that elevates the fear of disease or the restore health by balancing the doshas. Tadeva yuktam Bhaishajyam yadarogaya kalpite. In Ayurveda, the concept of Pada Chatushtaya refers to the 4 categories of essential elements necessary for the sustenance of life. These categories are like Vishak, Bhaishajya, Paricharaka, and Rogi. And among these, the Bhaishajya, that is medicine, holds a significant position, being essential for the treatment of diseases and the preservation of the good health. So here, there in the objectives of the syllabus copy, we have come to know that the only definition and as well as the different dosage forms used in the Ayurvedic formations are supposed to be included. Like we have different dosage forms like Panchamrita Kalpana, Churna Kalpana, Avaleha or Prashana, Ghana, Sattva, Vatika, Gutika, Vataka and Modaka and Varti, as well as we have the certain preparations like Kulu Kalpana, Masi Kalpana, Lavana Kalpa, Kshara Kalpana and Kshara Sutra as well. And also in objectives it is being given to look into the Prashasta Bhaishajya Lakshana. So this question may be going to ask for 5 marks. What are the Prashasta Bhaishajya Lakshana? Otherwise, rest other can be asked for the MCQs. So here, when you look into the Prashasta Bhaishajya Lakshana, Bahuta Tatra Yogyatvamena Aneka Vidha Kalpana Sampacheti Chatushkaha Ayam Dravyanam Punaha Uchyate. That is in the Ashtanga Hridaya Sutrasthana also has been given as Bahukalpam Bahugunam Sampannam Yogyam Aushadham, emphasizing the Bhaishajya in the Ayurvedic texts like those of Charaka and Vagbhata highlights its importance in maintaining the well-being. That is, Bhaishajya is a value for its applicability and the quality richness, abundance, and versatility in addressing the various health concerns. Hence, Bhaishajya is kept in second position among the Pada Chatushaya because of its great role in treatment grounds. While food is essential for nourishment, the medicine plays a vital role in restoring the health during the imbalance or the disease condition, emphasizing the significance of using appropriate medicines for overall health and illness management. So in this, the first point, the model question, something like the multiple choice questions may be, what is the primary goal of Aushadha in Ayurveda? The option should be like, to enhance the physical strength, to restore the homeostasis, and to treat the diseases, and to improve the mental health, and to provide the nutritional supplements. So here, as you know that, the Bahukalpam Bahugunam Sampannam Yogyam Aushadham, that which restores the homeostasis and that as well as which treat the disease. That would be the answer here. And probably the questions, as I said, the Prashasta Bhaishajya Lakshana can be asked for the SAQ here. So Lakshanaja Prashasta Bhaishajya may be asked. Otherwise, the scope of Aushadhi Prayoga Vidyana. So gist of this, the first point would be going to be asked in the examination for SAQ type of question. Moving to the second point of syllabus, that is a single drug, that is herbal and mineral, where a total of 10 marks is been allotted, and 2 MCQs are going to be asked out of which, and one the short answer question and one long answer question is going to be asked from this point. So whenever the students are going to be prepared for the examination concern, they're supposed to look into these all points, like for how many marks this syllabus point is going to be asked, and in which form, or whether it is going to be asked for the short answer question or the long answer question or say MCQs. Those all are of matter of concern here. So here I am going to deal. There are plenty of examples have been given, among which I'm going to deal some of the examples, and this is how you suppose to represent there in the examination. Considering this Guduchi Ghana, or call it as a Sanjeevani Vati. So here we have to mention the reference. The reference is as the AFI part 3, page number 183. Otherwise, the Siddha Yoga Sangraha Jora Rogadikara. And also you need to mention the ingredients proportion wise. The ingredients of this Guduchi Ghana or Sanjeevani Vati are Guduchi and Jala. So here the parts used are Guduchi is a stem, and proportion supposed to be is a 1 part, and Jala supposed to be taken as 4 parts, and that has to be subjected for boiling and should be reduced for 1 part. So after the reference and the ingredients quantity wise, then you're supposed to mention the procedures, SOP. So obtain the fresh or the dried Guduchi stems, ensure they are clean and free from the impurities. And second step is grind the Guduchi stem into the coarse powder using a grinder or khalva yantra. Place the Pata churna into a vessel and add 4 times of amount of the water to the vessel and let the mixture soak overnight. So this, then the next morning, heat the soaked mixture over a low flame, that on the mandagni, until the total quantity reduces to 1/4 of original volume. And this is now a decoction. It's a kwata now. So here, this kwata is filtered through a clean cloth to remove the solid residues, and transfer the filtered kwata into the stainless steel vessel and heat the kwata over a low flame once again until it becomes a concentrated form suitable for making that into a tablets or pills. Then roll it into a tablets or the pills. So expose the tray to the sunlight under the hot air, or under the sunlight, or the hot air oven for the several hours to be uh, uh, several hours to the several days until the material is completely dried. Once fully the material is dried, collect the dried material, and this final product is called as Guduchi Ghana. So store the Guduchi Ghana in a clean, dry, airtight container to preserve its potency and freshness. So this is what is the SOP of preparation of this Guduchi Ghana or Sanjeevani Vati. And the dosage of this is 250 to 500 milligrams and should be given along with the Madhu and Amrita, and indicated in, see, look, the dosage and usage are mandatory. This is what has been mentioned there in the syllabus point very clearly. That being the objectives, what we need to write in detail. So these all are the must to know points in that. First and foremost is the reference. Next, the ingredients quantity wise, and then after the SOP. After that is usage and the dosage. So here Anupanar, the Madhu and Krata, and indicated in the Jwara, Jirna Jwara, Raja Ikshva, Pandu, and Vishama Jwara like conditions. And certain points have been added into the newly framed NCSM syllabus, like the pharmacodynamics and the pharmacokinetics, as well as the research updates. So these all points would gather, the many more importance to your answer, and you need to mention all these pharmacodynamics, kinetics, as well as the research updates concerned to the particular yoga. So here in this Guduchi Ghana, that is Samshamana Vati, it is a concentrated form of Tinospora cardifolia that is renowned for its immunomodulatory and antipyretic properties. So these are the pharmacodynamics activity, the properties, like what the drug does to the body. And the potent bioactive compounds in Guduchi stimulate the production and the activity of white blood cells, enhancing the body's immune response to the infections and fevers. And it acts on the hypothalamus, regulating a body temperature and exerting the antipyretic effects, thereby reducing the fever. Guduchi's anti-inflammatory properties help to alleviate the symptoms associated with the fever, such as headache, the body ache, and as well as malaise. And the formulation's efficacy against the various types of fever, including the chronic intermittent fevers, and showcases its versatility in managing the different pathological conditions. So it is also aids in the management of conditions like anemia, pandu, and general debility, jirna jwara, and enhancing overall health and vitality. Next comes to this pharmacokinetics, where we are going to focus mainly on the ADME, absorption, distribution, metabolism, and excretion. Here, once a Samshamana Vati or Guduchi Ghana is taken orally, it absorbs through the gastrointestinal tract, allowing its bioactive compounds to enter the bloodstream. And distributed once after the absorption, the active compounds are distributed throughout the body, particularly targeting the immune system and the hypothalamus to exert their therapeutic effects. The compounds in the Guduchi Ghana are metabolized primarily in the liver, where they may be transferred into the more active or the inactive forms, and facilitating their therapeutic actions. And the metabolites are excreted by the kidneys, that in the form of urine, and the gastrointestinal tract, that is feces, ensuring the elimination of waste products from the body. So this is how the absorption, distribution, and metabolism and excretion of the certain drug, what you have been given into the given to the patient, is going to act as that you need to briefly explain. And coming to the research updates, must not to forget the research subjects, where the branch of Rasashastra and Bhaishajyakalpana. So basically, is going to look into the pharmaceutical aspect, the standardization aspect, as well as the clinical evaluation and all. So that is physicochemical standardization of the Guduchi Ghanavati with special reference to time of collection of Guduchi, where comparatively the Grishma Ritu, Guduchi collected in the Grishma Ritu is having a less potency than that of the Guduchi collected there in the Sharad Rutu. And a retrospective study on the efficacy of safety of Guduchi Ghanavati, that is Sanjeevani Vati, for COVID-19 asymptomatic patients. This has also been taken into consideration for the study during COVID pandemic. So this completes the first drug there in the second syllabus point. Likewise, I have chosen another one example like the Dhatri Lauha, where the reference is from AFI part 1, page number 284. And the ingredients of this Dhatri Lauha are Amalaki, Loha Bhasma, Istimadu, and Amruta Kwata. Here, Amalaki, the fruit is used, and Loha Bhasma is ash powder, Istimadu is used as a root, and Amruta Kwata is a stem. So proportion of this Amalaki, Loha Bhasma, Istimadu, and Amruta Kwata goes in this way: 8:4:2, and the quantity is sufficient of the Amruta Kwata. So here the procedure is all the required dried ingredients for the Dhatri Lauha are taken, and ensure each ingredient is clean and free from the impurities. So using a khalva yantra, that is a traditional mortar and the pestle, or a grinder, grind each of the ingredients separately into a fine powder, and filter each powdered ingredient through a clean cloth to remove any coarse particles in it, and combine all the filtered powders together in a clean dry container. Mix thoroughly to ensure a uniform blend of all the ingredients. And after completely thoroughly mixing, filter the compound powder mixture once again through a clean cloth to ensure a fine consistency. Attend to this, adding Amruta Kwata and triturate it for 7 times in a 7 days. So then after proper consistency, it is to be rolled into a tablet or paste. And these are dried in a sunlight or under a hot air oven for several hours to the days until the material is completely dried. If it is not completely dried, there are no chances of getting the affected by the fungus formation and all, and that may ruin the material or medicine. That's why we have to ensure that the material is completely dried. So once fully dried, collect the dried material, and this final product is called as Dhatri Lauha. So this is to be stored in a clean, dried, and airtight container to preserve its potency as well as the freshness. So here the dosage of this Dhatri Lauha is half to 1 gram per day. Always the dosages which have been mentioned there in the text are of per day dosages. You need to give it in divided dosages with the suitable anupana and all in the concerned respective conditions. Well, the dosage is half to 1 gram, and anupana is ghee and the honey, and indicated in the Shula Roga, Amla Pitta, Netra Roga, Anaha, Mandagni, Rakta Pitta, Pandu, Kamala, Palitya, and Vibanda. So there are the wide variety of the indications there meant for this Dhatri Lauha. Coming to the pharmacodynamics of this Dhatri Lauha, this is having the antioxidant and rejuvenating effect. Here, the Amalaki is rich in the vitamin C and other antioxidants that scavenge the free radicals and reduce the oxidative stress and enhance the cellular regeneration. And hematopoietic effect of Loha Bhasma is a potent source of bioavailable iron, so which is essential for the hemoglobin synthesis and erythropoiesis. And also having the anti-inflammatory and healing effect of Estimadu, which contains the glycyrrhizin, which has the anti-inflammatory property, and Amalaki supports the tissue healing. And the digestive health is going to be looked after by the Amalaki and Estimadu. So these herbs enhance the digestive fire and improve the nutrient absorption and soothe the gastrointestinal tract. The liver protection and detoxification, that is Guduchi Ghana, enhances the liver function and detoxifies the liver and supports the metabolic process. And nevertheless, the improvement of eye health because of the Amalaki having a vitamin C content, the high vitamin C content and antioxidant properties of Amalaki supports the eye health, and that improves the vision. And coming to the pharmacokinetics of this Dhatri Lauha, The formulation is absorbed through the gastrointestinal tract. The presence of honey and the ghee as anupana enhances the absorption of the fat soluble vitamins and as well as minerals. Probably most of the bhasmas and the rasaushadhis are going to be used along with the madhu and ghrita. This is all because the bhasmas are better absorbed there in the lipid media, and because of that, the commonly the madhu and the ghrita are used as anupana for the administration of this bhasmas or say rasaushadhis. Well, coming to the distribution of this Dhatri Lauha, once it is absorbed, the active compounds are distributed via the bloodstream to the various tissues and the organs where they exert their therapeutic effect, and metabolized they are primarily in the liver, and they are biotransformed into the active metabolites, and that enhances their bioactivity. And the metabolites are excreted through the kidneys in the form of urine and the gastrointestinal tract in the form of feces. So here certain the research updates like the Dhatri Lauha in the management of iron deficiency anemia, a prospective open level single or multicentral trial has been conducted, and importance of Rasayana drugs in the Dhatri Lauha with special reference to the Garbhini Pandu, that is iron deficiency anemia in the pregnancy, has also been taken up as a research there in the iron deficiency anemia in the pregnancy condition. So there in this continuation of this, we'll come across some of the Bhallataka preparations, where in the objectives of the syllabus point, it is clearly mentioned that Bhallataka is mentioned as a nice to know, and that is only going to be asked there in the bios. And the next drug is Gandhaka Druti. So here the reference is Rasaratna Samuchaya, the third chapter. And the ingredients are Shuddha Gandhaka, Trikatu Churna, and Tilataila. See, I would have mentioned the quotations and all here. Kalam Chiyusi Sayuktam, Vastrabandham Mikaj. See, look, I have not quoted all these quotations since because lack of the time duration and all. And if you want, you can quote the quotations as well here. Otherwise, the drug name, the parts used as well as the proportion. Ingredients proportion wise. Shuddha Gandhaka is taken as a 1 part, and Trikatu Churna is taken as 1/16 part, and Tilataila quantity is sufficient here. And SOP has collect all the ingredients of Gandhaka Druti and take Shuddha Gandhaka, Trikatu Dravyas, and make it into a very fine powder. Place a piece of cloth on a flat surface and spread the Shuddha Gandhaka Churna and Trikatu Churna evenly over the cloth. Roll the cloth like a wig and tie the whole roll with a thread, and dip this wick into a vessel filled with the tilataila for 3 hours. And after 3 hours, pick up the wick with the holder and light it with a mastic. As the wick burns, Gandhaka will melt and drop down into the form of oil, and collect the oil and preserve in a glass container. So this is what is called as Gandhaka Druti, and used there in the dosage of 3 drops, and used with the Anupana, Nagavalli Patra Sorasa, or Churna, or Shuddha, and as well as Shuddha Bharata is mixed along with that, and indicated in Agnimandya, Aruchi, Kshaya, Panduroga, Kasa, Shwasa, Shula, and Amatisara. Coming to the pharmacodynamics of this Gandhaka Druti, so it's the best Deepana. Gandhaka Druti acts as a potent Deepana, stimulating the digestive fire and improving the appetite, and this action helps in enhancing the digestion and assimilation of nutrients from the food. And this is the best Tikshna, hence it contains since it contains the Gandhaka and Trikatu, the combination of all the Trikatus, and which impart the sharpness of the preparation, and this sharpness aids in digesting the ama and alleviates the symptoms of indigestion. And also this Gandhaka Druti acts as a best rasayana. Gandhaka Druti may possess rasayana properties contributing to the rejuvenation and the revitalization of the body. It helps in promoting overall health and well-being. and also it is best Vata Kafahara. The formulations, since it is a Tikshna in nature, helps in pacifying the aggravated Vata and Kapha doshas, thereby providing the relief from the conditions associated with the imbalance, such as respiratory disorders, digestive issues, and the general weakness. And here the pharmacokinetics, once again the ADME absorption when administered orally or topically, the Gandhaka Druti is absorbed through the mucous membranes or the skin. The active constituents enter the bloodstream and reach their targeted tissues. And the active ingredients of Gandhaka Druti are distributed throughout the body, exerting their therapeutic effects on various organs and systems. And the metabolism of Gandhaka Druti may occur primarily in the liver, where the active constituents are biotransformed into the metabolites, and these metabolites may then undergo the further transformations or be eliminated from the body. Here, elimination is taken place there through the urine and the feces, and the elimination process helps in maintaining the body's equilibrium and preventing the accumulation of the toxins. And here are the couple of research updates concerned to this Gandhaka Druti, as pharmaceutical study on the Gandhaka Druti, a review article, and review on Druti Kalpana with special reference to the Gandhaka Druti. And next is the Laghusutashekhara Rasa, the compound formulation, where the reference is AF5 part 2, page number 282, and Rasatantra Sara and Siddha Prayoga Sangraha, and as well as there in the Karliya Rasayana 330. The ingredients are Shuddha Swarna Vanga and Shunti Churna and Nagavalli Swarasa. Here, 2 parts of Shuddha Swarna Vanga supposed to be taken, and 1 part of Shunti Churna is triturated along with the Nagavalli Patra Swarasa. So, gather all the clean and dried ingredients, ensure each one of is free from the impurities once again, and using a Kalmayantra, make it each of the ingredients separately into fine powder, and filter each powder ingredient through the clean cloth to remove any the coarse particles, and combine all the filtered powders thoroughly together in a clean and dry container. Filter the compound mixture once again through a clean cloth to ensure the fine consistency, adding the Nagavalli Swarasa as a bhavana for 3 days until it becomes the concentrated form and suitable for making tablet or the pills, and then roll it into tablets or the pills. So once fully dried, collect the dried material, and this final product is called Laghusutashekhara Rasa, where it is to be stored in a clean, dry, airtight container to preserve its potency and freshness. And this Laghusutashekhara Rasa is used in the dosage of 250 mg to 500 mg with the Sita Yukta Dugdha. There in the sugar mixed milk supposed to be taken as an anupana here. So indicated in the Ardhava Vedaka, Suryavarta, and Pittaja Shirashula, Daha, and Mukapaka conditions. So here, this Laghusutashekhara Rasa is going to act as analgesic by exhibiting the analgesic properties which help in elevating the pain associated with the Pittaja Shirashula and Ardhava Vedaka and other conditions affecting the head and the face. So anti-inflammatory property, that is the formulation possesses anti-inflammatory effects, reducing the inflammation and swelling in the conditions like Suryavarta and other conditions pertaining to the Pittaja Unmada like disorders. And it is having a cooling effect, that Laghusutashekhara Rasa has a cooling effect on the body, which helps in pacifying the symptoms like Daha and Urdhva Rakta Pitta like conditions. And it is a best digestive since it is having a shunti in it. The formulation that aids the digestion and helps in the managing the Pittaja conditions, including the Pittaja Shirashula, Mukapaka, like such conditions. And here coming to once again the pharmacokinetics of this particular yoga, Laghusutashekhara Rasa. The active constituents of Laghusutashekhara Rasa through the are absorbed in the gastrointestinal tract upon oral administration, And shunti may enhance the absorption of the other ingredients due to its bioavailability enhancing property. So here, once absorbed, the components are distributed throughout the body by the bloodstream, and they exert their therapeutic effects on various target tissues, including the head, face, and the digestive system as well. So metabolism of ingredients may occur in the liver and the other tissues. The metabolites formed may contribute to the observed pharmacological actions, including analgesic and anti-inflammatory effects. And metabolites and the unmetabolized residues are eliminated primarily through the urine and the feces. And the duration of excretion depends on the factors such as the renal function and hepatic metabolism. Research updates concerned to this Laghusutashekhara Rasa, that is standardization of Laghusutashekhara Rasa, an analytical study, and scientific explanation of Laghusutashekhara Rasa in the Amla Pitta condition. Here comes the third syllabus point there in the paper 2, that is single drug, either in the form of Bhasma or Shuddha, Rasadravya or Pishti. So this is also carrying the 15 marks is going to be asked there in the examination, either as a long essay question. What I mean to say is for 10 marks, otherwise short and as well as the short answer question and 4 of the MCQs. So Abhraka Bhasma, if it is being asked there in the examination for the long answer question. So whatever I am dealing here now are all for the long answer question, and depending on the short answer question, long answer question in MCQs, you can modify the answers while writing the examination. And here comes the Abhraka Bhasma as per the reference of Rasatarangini 10 by 39 to 42, where to prepare this Abhraka Bhasma, we need certain the drugs like Dhanyabraka and Arka and Nekrodha Mulapata and Rambharasa. Here Dhanyabraka as a one part, and each of these Bhavana Dravyas like Arka Dukta, Nekrodha Mulapata and Rambharasa, that is Kadali Kandaswarasa, as quantity sufficient we are required. And the procedure is triturate the Dhanyabraka well with the Arka Kshira for 1 day, first and foremost step, and prepare the thin flat chakrikas and dry them under the sun. And place these chakrikas in a Sharava Samputa and apply Sandhilepa. And then after complete drying, this is subjected for the Gajaputa. So repeat this process for 7 times. So after the 7 times, next follow the same procedure, but the instead of using the Arka Dukta, use here Nekrodha Mulapata as a Bhavana Dravya. And repeating the process for 3 times. So in the final phase, we should use the Kadali Kandaswarasa as a Bhavana Dravya and repeat the process for 7 times. Earlier, 7 Bhavanas of Arka Kshira, later on, the 3 Bhavanas of the Nekrodha Mulapata, and finally, once again, the 7 Bhavanas of Kadali Kandaswarasa supposed to be given. And subjecting them after preparing the chakrikas and all, drying it out, keeping it into the Sharavas, Sharava Samputikarana, Sandhi Bandhana, after complete drying, subjecting for the Gajaputa. So after this, perform the Bhasma Pariksha supposed to be performed over the Abhraka Bhasma. And if it passes all the Bhasma Parikshas, then Abhraka is ready for administration. So here the Puta, what is supposed to be given is Gajaputa. And usage and dosage, like it is used in the dosage of 125 milligram to 375 milligram, that is 1 rati to 1.5 rati. And the Anupana are supposed to be used as a Triflakwata, Guduchi Swarasa, Madhu, Gruta, and Ardhraka Swarasa. Indicated in the conditions like Agnimandya, Grahani, Shwasa, Kasa, Prameha, Pandu, Keshapatana, Tokroga, Jara, Napunsakata, Kushta, Liha, Udara, Visha, and Krimirogas, etc. etc. So here, some of the pharmacological actions of this Abhraka Bhasma are, first and foremost is best rasayana. So when you go into the Falashruti of Abhraka Bhasma, Gauri Tejam, Paramamrutam, Vata Pitta Kshegnam, Pratyabodhi Prashamitarusham, Rushyam Ayushyam Agrajam. So it is a Rushya Ayushyam Agrajam is nothing but the Rasayana, one which enhances the longevity. Well, Abhraka Bhasma is a potent rejuvenating substance that enhances the vitality and promotes the longevity at the cellular level. And it is also best cardioprotective, which regulates the blood pressure and improves the circulation and strengthens the heart muscles. Nevertheless, this is a potent antioxidant. Dear students, keep it in mind that all the bhasmas are the oxide forms of the respective the metals and minerals. So oxide forms is nothing but the antioxidant. So keep it in mind that all the bhasmas are potent antioxidants. Well, being the antioxidant which scavenges the free radicals and preventing the cellular damage and delaying the aging. Also, this do act as a immunomodulatory, enhances the immune system function and boosting the defense mechanism against the infections. And also, it is a best aphrodisiac, as I mentioned, Rushyam Ayushyam Agrajam, which promotes the sexual health and vitality, addressing the issues like the erectile dysfunction and low libido. Anti-inflammatory activity is also going to be seen there in the Abhraka Bhasma, which reduces the inflammation and providing the relief from conditions such as arthritis and the gastritis. And this is also best Pramehakna, the anti-diabetic, which helps to regulate the blood sugar levels and improve insulin sensitivity in managing the diabetes mellitus. So certain research updates like the pharmaceutical and analytical study of the Abhraka Bhasma and a study of general properties of Abhraka Bhasma in nanomedicine are the some of the research updates concerned to this Abhraka Bhasma. The next one is Tamra Bhasma. Here the ingredients are Shodhita Tamrapatra and Kajali and Nimbosorasa. Here Shodhita Tamrapatra supposed to be taken as one part and Kajali for the initial stage, it is to be taken for the first stage. It is to be taken as a one part, and from second puta onwards, supposed to be taken as 1/4 part. And here Nimbosorasa is taken as the quantity sufficient as a bhavana dravya. So procedure like Kajali obtained from triturating the Shuddha Parada and Shuddha Gandhaka is added with the lemon juice and applied to the Shodhita Tamrapatra, and these are dried and kept in a Sharava, and Sharava Samputikarana is done and subjected for the Gajaputta for 3 times, by which the Tamra becomes Bhasma. And the note is that after the first Putta, the copper leaves become brittle. The Tamra Patra are going to become brittle and can be powdered easily. Greater the brittleness, easier that can be converted into the Churna. And hence, the Kajali, that is in the quantity of 1/4 of that to the Tamra, is supposed to be added from the second time onwards and mixed with the lemon juice and ground to a paste, and which is made into a small coin like what do you call it as chakrikas, and dried and subjected to the incineration in the second and the third puta. And here the Tamra Bhasma is given as 31.25 to 62.5 milligram of the dosage, and with the anupanas like Trikatu Kashaya, Agrita, Madhu, and Duralabha Kvata, Abhraka Rasa, and Guduchi Rasa, etc. And used in the conditions like Udara Roga, Sthaulya, Jalodara, Shotha, Vata Roga, Kafaja Roga, Visha, Rajakshma, Kasa, Shwasa, Netra Roga, Kusta, Parinama Shula, Gulma, Priha Yakrut Roga, Meha, that is Prameha, Kshaya, and Grahani. In all these conditions with a different sort of anupana, this Tamra Bhasma is used. Here, the pharmacology of this Tamra Bhasma once again, which is mentioned there in the Rasataringini as Tamra Bhasma along with the Grita and Duralabha Kvata cures the Brahmaroga, and it cures the colic when it is taken along with the powder of Karanja Bija. And in the condition called splenomegaly and pain, along with the Shankha Bhasma and Trikatu, it is going to have its very good effect. And in case of hyperacidity, it is to be used along with the Dhatri powder. And piles within 1 month when taken along with the Nagapushpa and Abhaya. So this is going to cure the piles within 1 month itself. It is if it is being used along with the Nagapushpa and Haritaki. And there in the hepatomegaly condition, it is to be used along with the Trikatu and the Madhu. And gulmai and the diarrhea can also be going to be get cured if it is used along with the Trikatu and Grita. So certain research updates like standardization of the manufacturing process of Tamra Bhasma and the pharmaceutical analytical study of the Tamra Bhasma have been taken into the research, the concerns. The next one is, I have taken some of the examples, like the compound formulation, the Bhasmas, and as well as the Pishti. So here the Pishti reference is AFI, the part 1, that is Pishti, and Ayurveda Sara Sangra of Shodhana Marana Prakarana. The ingredients like Shuddha Pravala and Gulab Arka. So Shuddha Pravala is taken as one part, and Gulab Arka is to be taken as quantity sufficient here. And as you know that the Pishti preparation is very simple. That is the Shodhita Pravala is to be washed with the warm water and it is dried, and then later on taken into the Khalbayatra and it is saturated with the Gulab Arka for 7 days. And then after proper the Mardhana, it is to be collected and stored, and that is what is dried and stored, and that is what is called as the Pravala Pishti. And it is used with a dosage of 250 milligrams, and Anupana as the Madhu, Vrita, and Navanita. And indications like the Kasa, Pittaroga, and Monodhaurbalya, Ujokshaya, and Hrudraoga. In all these conditions, this Pravala Pishti is used. The pharmacodynamics of Pravala Pishti, as it is composed of purified coral and the rose water, which treats the cough and pitta disorders and the mental weakness and immune deficiency, and as well as heart ailments. Its properties include the antitussive, cooling, and the cardiac tonic effect, likely due to its the mineral content and soothing the rose water. And Anupana ingredients like honey, butter, and the ghee may enhance its efficacy if it is used along with. And pharmacokinetics, like they administered orally at a dosage of 250 milligram, and Pravala Pishti is absorbed in the gastrointestinal tract and distributed throughout the body. And metabolism excretion pathways may vary, influenced by the individual factors and the formulation composition. And Anupana choices such as the honey, butter, and the ghee may impact the absorption and effectiveness of this particular Pravala Pishti. And certain research updates like pharmaceutical standardization of the Pravala Bhasma and Pravala Pishti, and oral bioavailability study on the Pravala Pishti and Pravala Bhasma. In the context of Ratna, it is clearly mentioned that Ratnanam Shodhanam Shreshtam Maranam Durgunam Pradam. Since because all the Ratnas are having the calcium components, calcium carbonates, when it is being converted into their Bhasma, they are going to be converted into calcium oxides. So they are, resulting into the Ksharia in nature. The burning of the tissue can be seen there in the Bhasmas. So rather than that, rest other properties of the Pishti will be same as like that of the Bhasma, but Pishti will be having the Shita Virya. But here Bhasmas will be having the hot potency. That is what the difference. And that is what the oral bioavailability study on the Pravala Pishti and Pravala Bhasma has been taken into consideration as a one. And the fourth syllabus point, that is Aushadhi Kalpa 1, where the compound formulations have been mentioned here. And this is also going to be asked in the examination for 15 marks. Same, the 4 of the MCQs, 1 short notes, short answer question, and the 1 is long answer question. And here I have chosen certain examples, and among that the Arogyavardhini Vati. The reference is AFI, and the first Rasa Yoga, Rasaratna Samuchaya, Visarpa Chikitsa. And here what we supposed to keep into mind is, there in the objectives clearly mentioned that this is important for biology, and that too the research update and clinical evidences are going to be asked in the biology concerned with this Arogyavardhini Vati. And the ingredients are Rasagandha Lohabram Shulva Bhasmam Samamshikam Trifalaadviganam Prokta Trigunam Cheshilajituhu Chaturgunam Puram Shuddham Chitramulam Chatatsamam Tikta Sarva Samadneya Sanchurnayet Nimbarukshadalambover Mardayet Dvidinavadhi. That is what the ingredients have been mentioned here as. Shuddha Parada, Shuddha Gandhaka, Abhraka Bhasma, Tamra Bhasma, Loha Bhasma has each one part. And Trifla has 2 parts, Shuddha Shilajitya has 3 parts, Shuddha Gurukula has 4 parts, Chitrakamula has Tatsamam, that is 4 parts, and Katuki Sarvasamadheya. So that is total parts as that of all the rest of the ingredients. That is 22 parts. And Nimba Swarasa, Nimba Rukshadala, Ambu Swarasa has the quantity sufficient of Havanadravya here. Look, the procedure goes in this way. Collect all the ingredients of Arogyavardhini Gutika and first prepare the kajali by triturating Shuddha Parada and Shuddha Gandhaka and the Khalva Yantra, and add rest other ingredients to grind well to ensure the uniform mixing, and add an appropriate quantity of Nimba Patra Swarasa and continue triturating for 2 days. So after a proper consistency, the shape of the mixture into the pills of the size of a big Badarafala, that is Rajapolo Pramana. And however, the Arogyavardhini Gutika are usually prepared with the weight of 3 Rati Pramana. And dry the pills in a shade and preserve the dried pills in a glass container or airtight container. And this is used with a dosage of 250 to 500 milligrams. And with the anupanas like Abhraka Sorasa, honey, Nimba Sorasa, the lukewarm water, otherwise the milk. Used in the conditions like Jirna Jwara, Medo Dosha, Kushta, and Ekrit Vikaras. Coming to the pharmacodynamics of this Arogyavardhini Vati. So detoxification and purification is going to be seen there in the Arogyavardhini Vati, where because of Haritiki, Bibitiki, and Amaliki, which helps in eliminating the toxins from the body. And this purification process aids in the management of various disorders by removing accumulated waste and improving the metabolic functions. And this is also going to act as the anti-inflammatory. The combination of ingredients in Arogyavardhini Gutika exhibits a significant anti-inflammatory properties. This helps in reducing the inflammation associated with the conditions such as Jirna Jwara, Medo Dosha, and Kushta, providing relief from the pain and swelling. And this is a best immunomodulator where Shuddha Parada and Shuddha Gandhaka contribute to the immunomodulatory effects of the formulation. They help in enhancing the body's immune response, thereby aiding in the management of various infections and autoimmune disorders. And this is the best hepatoprotective. Arogyavardhini Gutika supports the liver health and function. It helps in managing the Vikara by promoting the regeneration of the hepatic cells, improving the life function, and protecting the liver from damage caused by the toxins and free radicals. And it's the best metabolic regulator as well. The inclusion of Erenda and the Katuki roots helps to regulate the metabolism, especially the fat metabolism. This can be beneficial in conditions related to the lipid metabolism disorders and the obesity. Coming to the pharmacokinetics, the active constituents of Arogyavardhini Gutika are absorbed primarily in the gastrointestinal tract after the oral administration. And once absorbed, the herbal compounds undergo the metabolism in the liver, where they may be transferred into the active metabolites or excreted as a waste products. So the metabolites and the active compounds are distributed throughout the body via the bloodstream, reaching targeted organs such as liver, skin, and the immune system. And any unutilized the constituents or the metabolites are primarily eliminated through urine and the feces, and the duration of action and the elimination of the half-life may vary depending on the specific ingredients and the individual factors. So research updates concerned to this Arogyavardhini Vati as the pharmaceutical standardization of Arogyavardhini Gutika and clinical evaluation of efficacy of Arogyavardhini Vati in the management of the liver disorders. And the next one is Anandabhairava Rasa. The reference is AF51, Rasa Yoga 20/3, and Rasendra Sara Sangraha Choradikara. So here the ingredients of this Anandabhairava Rasa are Shuddha Hingula, Shuddha Vatsanaba, Shunthi, Pippali, Maricha, Shuddha Tankana, Jati Phala, and Jambira Swarasa. Here the Shuddha Hingula, Shuddha Vatsanaba, and Shunthi are taken as each one part, and as well as Shuddha Tankana and Shuddha Jatifala are taken as each one part, whereas Pippali and Maricha are each taken as a two parts, and Jambira Swarasa here used as a Bhavana Dravya, and which is supposed to be taken as quantity sufficient. And here the procedure of preparation of Anandabhairava Rasa is take all the ingredients required for the Anandabhairava Rasa, ensure each ingredient is clean and free from the impurities, and using a Khalva Yantra or a grinder, grind each and every ingredients from Shundi to the Jatifala separately into a fine powder. Filter each powder ingredient through a clean cloth to remove any coarse particles in it, and combine all the filtered powders together in a clean dry container and mix thoroughly to ensure a uniform blend of all the ingredients. Filter the compound powder mixture once again through a clean cloth to ensure a fine consistency. Adding Jambira Sorasa and triturate well until it becomes suitable for making tablets or the pills, and then roll into a tablets or pills. Expose the tray to the sunlight to dry. Collect the dried final material and called as a Anandabhairava Rasa. Store the Anandabhairava Rasa in a clean, dry, airtight container to preserve its potency and the freshness. So this Anandabhairava Rasa is used in the dosage of 250 milligrams per day, and Anupana as Abhraka Rasa and Madhu. So indications of this Anandabhairava Rasa are Jwara, Jwaratisara, Amavata, Sannipata Jwara, Ashmari, Prameha, and Mutrakruchra. So pharmacodynamics of this Anandabhairava Rasa as it's the best antibiotic, where it exhibits the potent antibiotic property primarily attributed to the ingredients like Shunti, Pippali, and Maricha. And these ingredients possess the thermogenic effects, including the sweating and reducing the fever. Here, I would like to tell about this Vasanaba. Vasanaba is going to act as a Shveda Janaka by making the Shrota Shodhana, and the Shveda Pradurbhava will be there in the Jwara condition. It is going to get reduced, or it is going to get recorrect that Shveda Pradurbhava and causing the sweating. This Vasanaba is one of the main ingredients in it. The combination of Shuddha Vasanaba and the Shuddha Hingula provides the anti-inflammatory effect, elevating the inflammation associated with the conditions like Amavata and Sannipata Jwara. And for your kind concern, here all the Vishadravyas are best potent anti-Vata. That means to say that the best Shulahara and Shotaprashamana Dravyas. And here this Anandabhairava Rasa is also best digestive stimulant. And here the Shunti, Pippali, and Maricha stimulates the digestion and enhances the gastrointestinal motility. This property aids in the management of Jwara Atisara and Prameha by improving the digestive function. And also it do act as a diuretic, where it exhibits by helping the management of the conditions like Mutrakruchra and Ashmari by increasing the urine output and promoting the expulsion of the renal stones. Coming to the pharmacokinetics of this Anandabhairava Rasa, where the ingredients of Anandabhairava Rasa are likely absorbed in the gastrointestinal tract with a faster absorption facilitated by the liquid form of the Jambira Surasa, that is lemon juice, and which was used for the Mardana or Bhavana. Upon absorption, the constituents undergo hepatic metabolism, where they may be metabolized into the active metabolites or conjugated with the glucuronides for the elimination. And the active compounds are distributed by the bloodstream to the various targeted organs, including the liver, kidneys, and the inflammatory sites, where they exert their pharmacological effects. And any unutilized constituents or the metabolites are primarily eliminated through the urine in the feces. The duration of action as well as elimination of half-life may vary based on the individual factors and the specific metabolism of each ingredients there found mentioned there in the Anandabhairava Rasa. And certain research updates concerned to this are the critical review on Anandabhairava Rasa with special reference to the Rasayogha Sagara, and evaluation of the physicochemical and antipyretic activity of Anandabhairava Rasa have been taken up as the research activities. And the another example concerned to the Parpati, I have chosen this Panchamrita Parpati with a reference of AFI part 1. That is mentioned there in the Parpati 16/1, and Bhaishajya Ratnavali, where Grihani Rogadikara, this Panchamrita Parpati is found mentioned. And the ingredients are Shuddha Parada, Shuddha Gandhaka, Abhraka Bhasma, Laghusutashekhara, and Tamra Bhasma. Since there are 5 ingredients, Panchamrita Parpati, the Parpati method of preparation of Parpati is as that of the normal preparation of Parpati. Shuddha Parada, Shuddha Gandhaka, Abhraka Bhasma, Laghusutashekhara, and Tamra Bhasma. 5 ingredients, and hence Panchamrita Parpati. And the Shuddha Parada is used as 1 pala, and Shuddha Gandhaka is used as 2 pala, that is 1:2 ratio, Parada is to Gandhaka. Kajali is prepared, and to this Kajali, 1 part of Abhraka Bhasma and 2 parts of Laghusutashekhara and half part of Tamra Bhasma has been added. That is, prepare the Kajali with the Shuddha Parada and Shuddha Gandhaka and Kalva Yantra. Add the remaining ingredients 1 by 1 and mix well in the Kalva Yantra. Place the mixture in an iron vessel and heat it using the Sikta Yantra, such that the homologous, what I can say, the heat is going to be seen, and make a shallow pit in a fresh cow dung and line it with a kadali or erandali. And when the mixture melts, it becomes liquid, and pour it onto the kadali patra, grita lepita kadali patra. Cover it with another grita lepita kadali patra, and gently it is pressed with the fresh cow dung, and allow the mixture to cool. And remove the part which has been pressed with it, and the flakes are going to be collected, and it is washed, and then after dried and powdered into the medicine, and this is being stored in a airtight glass container. And Panchamrita Parpati is used with a dosage of 125 to 250 milligrams, along with the honey, agrita, and brashta jiraka churna. Here, the Panchamrita Parpati is indicated in the conditions like Grahani, Arsha, Jhardi, Atisara, Jwara, Aruchi, Kshaya, and Raktapitta. And the research update concerned to this as a clinical study of role of Panchamrita Parpati in Grahani Vyadhi and lifestyle principle. So there the Parpatis are known for their best action in the Grahani condition. Hence this Panchamrita Parpati is the best drug of choice in case of the Grahani conditions. The pharmacodynamics, like Shuddha Gandhaka, which possesses the antimicrobial and anti-inflammatory and as well as detoxifying properties. It helps in managing the digestive disorders, infections, and inflammatory conditions. Shuddha Parada acts as a potent antimicrobial and detoxifying agent. It enhances the efficacy of other ingredients and helps in balancing the three doshas. And Laghusutashekhara, which provides the essential iron, which is crucial for treating anemia and improving hemoglobin levels. So it also has the rejuvenating properties and enhances the overall vitality. Abhraka Bhasma, known for its rejuvenating, anti-aging, and adaptogenic properties, it supports the respiratory system, improves the digestion, and enhances the overall health. And Tamra Bhasma, it possesses the antimicrobial and anti-inflammatory action, and as well as hepatoprotective property. So it aids in improving the digestion, liver function, and overall metabolic processes. Coming to the pharmacokinetics related to this Arogyavardhini Gutika, Panchamrita Parpati, here the bioavailability of active compounds is enhanced by the presence of bioavailability enhancers like Shuddha Parada and Shuddha Gandhaka, where the Kajili is considered to be the best bioavailability enhancer, where this also do act as the catalyst and reach to the targeted target. The fine particulate nature of the plasmas aids in their absorption. and the active components are distributed by the bloodstream to the various tissues, particularly targeting the digestive system, liver, and the blood. The ingredients like Loha Bhasma and Tamra Bhasma are metabolized in the liver. The other ingredients undergo the specific metabolic processes to provide their therapeutic benefits without toxicity. And the waste products of these ingredients are excreted primarily through the kidneys in the form of urine and the intestines in the form of feces. And detoxifying the agents ensure the efficient elimination of the residual substances from the body. The next one from the category of this Kupi Pappa Rasayana preparation, I have chosen as the Swarna Vanga, where the reference is from AFI 1, the Kupi Pappa Prakarana, 15/9, and Rasamrita 3/95 to 100. And the ingredients are Vanga Bhasma, Shuddha Parada, Nimbu Swarasa, Shuddha Navasadana, and Shuddha Gandhaka. So here, the Vanga Bhasma is used as a 3 pala, that is 144 grams. Shuddha Parada is used as a 1.5 pala, that is 72 grams. And Nimbu Swarasa as a Bhavana Dravya as a quantity sufficient. Shuddha Navasadana is and as well as Shuddha Gandhaka are used as that of the Shuddha Parada, that is 1.5 pala. Here the procedure as collect all the ingredients of Swarna Vanga, heat the Shuddha Vanga, that is tin, in an iron ladle until it melts, and add half the amount of purified mercury to the melted Shuddha Vanga. That is, if you have taken 3 pala of Shuddha Vanga and it has been molten there in the iron ladle, soon after melting, add the 1.5 pala of Shuddha Parada into it, and it is amalgamated thoroughly. And immediately pour the mixture, after amalgamation, immediately pour the mixture into the Khalva Yantra and grind it well until it becomes a fine powder. And add a small amount of Saindhava Lavana to it. And saturate the mixture with the Nimbu Swarasa. Wash the mixture with the water until the blackness ceases, and dry the mixture. Until unless we get completely rid of this black color out of that mixture, triturating mixture, we need to wash it out. The Nimbu Swarasa is added, triturated, and if it leaves once again black color, it's supposed to be get subjected for washing. Until unless we get rid of this blackness, that has to be washed with the water, and later on it is dried. After drying, add the equal quantity of Navasadana and Shuddha Gandhaka to the mercury. Grind it well until a fine, smooth powder like a kajal is obtained. Fill the prepared powder into a glass bottle. That is what is Kacha Kupi. Kupi Bharana has to be done. And place the Kacha Kupi in a sand bath. That is Valopa Yantra. And apply heat for 4 yamas. That is 12 hours carefully. That is carefully here in the sense Trivida Agni Paka Karma has to be followed. Rudu Agni, Madhyama Agni, Tivra Agni has to be followed here. And when the fumes stop coming out of the Kachakupi, remove it out from the furnace along with the Valoka Yantra and place it on the earth on a cool, so as to cool naturally. Swanga Shita supposed to be happen. Once the Swanga Shita is achieved, take out the Kachakupi, clean the Kachakupi, that is the cupboard metal layer and everything has to be scrapped out, and then it is to be broken by the traditional method, that is kerosene thread is dipped in the kerosene, it is tied at the center, it is ignited, and it is wrapped with the cold cloth such that it is going to be get broken into equal halves. Carefully, the golden colored Swarna Vanga from the bottom of the bottle supposed to be get collected. Since the Swarna Vanga is a Mismaniyar, which is not having any Swarna in it, though the end product which mimic like the golden glittering color, hence the name came to it as Swarna Vanga, the Vanga preparation which has resulted into the Swarna color, hence the Swarna Vanga. Well, this is used as in the dosage of 125 to 250 milligrams with the anupanas like the Navanita and Madhu, and indications like Jirna Kasa, Shwasa, Prameha, and Mutra Marga Roga are better going to be cured by this use of Swarna Vanga. And the pharmacodynamics as Vanga Bhasma, which possesses the antimicrobial, anti-diabetic and anti-inflammatory properties, and it is beneficial in managing the respiratory conditions as well, and also the urinary disorders, and basically the diabetes. And Shuddha Parada acts as a potent antimicrobial, detoxifying and rejuvenating agent. It enhances the therapeutic efficacy of the formulation and helps in balancing the three doshas, that is Vata, Pitta, Kapha. And Shuddha Gandhaka, purified sulfur, which provides the antimicrobial and anti-inflammatory and detoxifying effects. It helps in managing the infections and reducing the inflammation as well, and purifying the blood. And Shuddha Navasadhara, known for its expectorant and diuretic properties, so it aids in cleansing or clearing the respiratory passages and promoting the urine flow. Pharmacokinetics, like the availability of active compounds, is enhanced by the presence of bioavailability enhancers like Shuddha Parada and Shuddha Gandhaka, and fine particulate nature of the bhasmas aid in their absorption. And the active components are distributed via the bloodstream to the various tissues, particularly targeting the respiratory system, urinary tract, and metabolic pathways. And the ingredients like Vanga Bhasma and Shuddha Gandhaka undergo the specific metabolic processes to provide their therapeutic benefits without toxicity. The other ingredients are metabolized primarily in the liver. And the waste products of these ingredients are excreted primarily through the kidneys in the form of urine and intestines through feces. And detoxifying agents ensure the efficient elimination of the residual substances from the body. And research updates concerned with this are the pharmaceutical standardization of Swarna Vanga and clinical evaluation of efficacy of Swarna Vanga in the management of Prameha. And coming to the Potali Kalpana, in that, Hemagarbha Potali is the only example which has been given, where the reference is from AFI 2 and Rasa Yuga Sagara 16/66 and Rasamrita 9/218 to 222. Here the ingredients are Shuddha Parada, Shuddha Gandhaka, Swarna Bhasma, Tamra Bhasma, and Kumariswarasa. I repeat once again the ingredients as Shuddha Parada, Shuddha Gandhaka. Kajila has to be prepared with a ratio of 4:2 ratio, and Swarna Bhasma has 1 part and Tamra Bhasma has 3 parts supposed to be added into it, and Bhavana Dravya has Kumariswarasa. Here Shuddha Parada, Shuddha Gandhaka are prepared into Kajali, add Tamra Bhasma to triturate, and then Swarna Bhasma at the end. So Kumariswarasa Bhavana is given for 7 days, and shape up the paste into the potali, that is Pugakara or Shikirara Mukha Krutva, conical shape, and place it in the Shuddha Gandhaka powder placed over a 4-folded silk cloth, and then this is tied into potali and hanged it in a porcelain glass beaker containing the Shuddha Gandhaka. So here keep the setup on a Valuka with a low flame, and keep Gandhaka in a liquid form. Gandhaka Dravana is supposed to be there throughout the process, and it should be kept on Mandagni. It should not be overheated. The next day, then when the temperature of potali reaches the room temperature, remove the outer coverings of the potali and take out the potali and scrape off any Gandhaka adhere to it, the outer surface, with a knife, and store it in a airtight glass container. The pharmacodynamics of this potali is Shuddha Parada here provides rejuvenating and detoxifying effects, and which boosts the immunity and promotes the overall well-being. And Shuddha Gandhaka exhibits the antimicrobial, anti-inflammatory effect, and antioxidant properties, supports the body's defense mechanism. Swarna Bhasma, known for its anti-inflammatory, immunomodulatory, and cardioprotective effects, enhancing the vitality and the strength. So here Tamra Bhasma is possesses the anti-inflammatory and antipyretic and hematinic properties, aiding in the management of various disorders. The pharmacokinetics are the active constituents are absorbed through the gastrointestinal tract and the mucous membranes. The bioactive compounds are distributed throughout the body via the bloodstream and targeting the various organs and the tissues. The ingredients undergo metabolism primarily in the liver where they are converted into the into metabolites with enhanced bioactivity, and the waste products are eliminated primarily through the urine and the feces. So this is used, the Hemagarbha Pottal is used in the dosage of 125 milligrams, 1 Rati Pramana, along with the Anupanas like Ardhraka Sorasa and Parna Kanda Sorasa, and indicated in the Sannipata Jejura. So here some certain research updates like the pharmaceutical standardization of Hemagarbha Pottal Rasa and clinical evaluation of efficacy of Hemagarbha Pottal Rasa in the post-COVID-19 lung fibrosis. So these recent clinical studies have been taken up. And the last, the fifth point is Aushadhi Kalpa-2, where the compound drugs or the formulations, in which I have taken up the example as the Pashanabhedana Churna, and the reference is AFI1, page number 130, or Bhaishajya Ratnavali, Brother Rogadikara, 66 by 25 to 30. The ingredients are Patha, Jambu, Amra, Pashanabhedana, and Daruharidra, Ambastaki, Raktachandana, Shwetasariva, and Arjuna, and as well as Lajjanu, the Kamala, Kunkuma, and Ativisha, Musta, Bilva, Katvanga, Thataki, Mocharasa, Lotra, Gairika, Katfala, Maricha, Shunti, Buddhivika, Kutaja, and Esti, or Estimadu. So each drugs are taken as one part. Gather all the required dried ingredients for Pashanabhedana Churna. Ensure each ingredient is clean and free from the impurities. Using a kalvendra or a grinder, each ingredients are separately converted into fine powder. It is to be filtered and combined, mixed. Again, it is filtered so as to ensure the fine consistency. Then the final compound of powder is sterilized, and the airtight glass container to be preserve its potency and freshness. And label the contents with the name Pashanabhedana Churna and the date of preparation as well. Though the pharmacodynamics of this Pashanabhedana Churna, as it is the best hemostatic, herbs like Lodra and Pata have hemostatic properties, helping to reduce the excessive bleeding, which is beneficial in conditions like Ashragdhara. And the ingredients such as Amra Bija and Jambu Bija provides the astringent action, which helps in tightening the tissues and reducing the discharge in conditions like Shweta Pradara. Anti-inflammatory properties of Daruharidra and Pashanabhedana, which reduces the inflammation and making the formula useful in treating the inflammation-related disorders. And components like Maricha, Shunti possesses the antimicrobial properties, which helps in combating the infections. And ingredients such as Musta and Raktachandana provides the pain relief, and may herbs in the formulations act as a uterine tonic and supporting the reproductive health and normalizing the menstrual cycles. The pharmacokinetics, like the powder from the Pashanabhedana Churna, is typically taken with the honey or Tandolodaka, that is rice water, which aids in the absorption through the gastrointestinal tract. The fine particles ensure a larger surface area for the better absorption. And distribution, after the absorption, the active constituents are distributed throughout the body via bloodstream, targeting the reproductive organs and other affected tissues. The herbal components undergo the metabolism, primarily the liver, where they are broken down into the active metabolites by hepatic enzymes. And the metabolites are excreted primarily through the kidneys, and some of the components might be excreted via the feces. So this is given with the dosage of 1:3 grams per day with the honey and Tandolodaka, indicated in the Ashragdhara, Shwetapradara, Rajodosha, Arsha, and Yoni dosha. The research update concerned to this Pashanabhedana Churna are the critical review of Pashanabhedana Churna, an Ayurvedic polyherbal formulation, a review study of effect of Pashanabhedana Churna in the Shwetapradara. And the next is Sanjeevani Vati, where the reference is Bhaishajya Ratnavali Jwaradikara, 5 by 1009 to 1011. The ingredients are Vidanga, Shunti, Pippali, Haritaki, Amalaki, Vibhitaki, Vacha, Guduchi, Shuddha Bilva, Shuddha Vasanava, and Gomatra is used as a Bhavana Drava with the quantity sufficient, and rest other ingredients are used as one part each. All the required ingredients are dried and are taken into kalpayantra or grinder, and they are separately powdered and combined together, once again filtered so as to make sure the proper homogeneity is supposed to be seen. And bhavana is given with the gomutra until it becomes a concentrated form and suitable for making it into tablets or pills. Expose the tablets dried, and after complete drying, they are going to be stored in a airtight container so as to preserve their potency and freshness. So here the dosage is 1 to 2 rati, and Anupana as Ardhaka Swarasa and Ushnodaka indicated in the Jwara, Ajirna and Aruchi-like conditions. The pharmacodynamics like antipyretic activity of the Shunti pipalin Vasanava possesses dissolve properties and reducing the fever by acting on the thermoregulatory center in the brain, and immunomodulatory effects, that is Guduchi boosts the immunity and enhancing the body's defense mechanism against the infections associated with the fever. And Haritaki, Amaliki, and Bibitiki aid the digestion and metabolism, addressing the gastrointestinal disturbances often accompanying there in the fever. And Vidanga and Vacha possesses the anti-inflammatory properties, reducing the inflammation and associated symptoms. So here the active ingredients in the Sanjeevani Vati are absorbed through the gastrointestinal tract after the oral administration, and the components are distributed through the bloodstream and targeted various organs and tissues affected during the fever and associated symptoms. Metabolism of the constituents occur primarily in the liver, where they are transformed into the active metabolites or undergo the conjugation for elimination. The metabolites and the unmetabolized components are excreted via urine and feces, with the elimination facilitated by the renal and gastrointestinal systems. And certain research activities with the Sanjeevani Vati are scientific review on Sanjeevani Vati with the special reference to its pharmacological actions, therapeutic indications, and pharmaceutics. And in vivo study of efficacy of Sanjeevani Vati in the snake venom poisoning. So here, the snake venom poisoning at the level of stage 3. So this Sanjeevani Vati is having its very right indication, and hence the in vivo study of efficacy of Sanjeevani Vati in the snake venom poisoning is being conducted as a research work. And the last point, that is the 8th point, Anupana Prayoga Vijnani. Here, it is going to be asked then for 10 marks. The Kaisharugugulu. Kaisharugugulu alone, a single drug with a different sort of Anupana, it is going to be used in various conditions like Vasadina, Netragadan, Gulmadin, Varunadina, Pathena Kadrisyapi, Ronakusthani Nashayet. Here, with the Vasakwata, it is this Kaisharugugulu, the same drug. With Vasakwata, it is used in the Netraroga. Along with the Varanapata, it is used to treat the Gulma condition. If it is used, Kaisharugugulu, if it is used with the Kadirakwata, it is going to be treated the Rona and as well as Kushta conditions. In the same way, I have taken up another example of Parpati, where the Rasa Parpati, the reference is Rasarangini, and Rasa Parpatika Sa Ajyam Unmadam Vihanashayet. Brahmi Rasa Sayukta Apasmaram, and Jiraka Grahani Hanti, and Yosha Nimpudalo Tatapasmaram, Shulam Gugulanam Pandushofam. Along with the Gugulu, it is going to cure the Shula, Pandu, and Shofa. And Datura Bija, that is Durta Bijan Hanti Unmadam, and Nimba Panchaka, Mallataka, Bakuchi, Brunga Sayuta, Nihanti Sarvakustani, and Dashamula Kashayana, Vatika Jwaram, and Trayushina Kshotra Sayuta, Khasakalu Kafotita. That is, along with the Ajya, that is Grita, if this Rasa Parpati is used along with the Ajya or Grita, it is going to get cure the Unmada. And this same Rasa Parpati is used along with the Brahmi Rasa, it is used to treat the Apasmara condition. And same Rasa Parpati is, if it is used along with the Jiraka Churna or Jiraka powder, it is going to be treated with the Grahani condition. And Trikatu and Nimbudala are used to treat the Apasmara. And the same Rasa Parpati is once used along with the Gugulu, it is going to give the Shula, Pandu, and as well as Shobha. And the Rasaparpati, if it is used either there with the Panchanimba or with the Mallataka or with the Bakuchi, Churna or with the Bringaraja, that is going to cure the Kushta. And if it is used along with the Dashimula Kashaya, the Vataja Jora is going to be cured. And at the last, if it is used along with the Trikatu Churna along with the Madhu, it is used in the, going to cure the Kafaja Kasa. So this is how Anupana Prayoga. With a single yoga, with a different sort of Anupanas, how we are gonna use in a different conditions and how this is gonna combat the condition, everything supposed to be written in the examination. So in just, I'm gonna tell you that this is where the certain formats of the forms, of the examples I have taken. This is supposed to be a skeletal of an answering. The first and foremost, the reference and the ingredients, the quantity wise, the SOP, after that the usage and dosage and indications, after that the pharmacodynamics, pharmacokinetics, and what do you call it as the research updates. So that will fulfill to get the set percent of marks there in the examination. So this is how you're supposed to prepare with the rest other sort of the examples which have been given in the syllabus copy. So with this, I would like to conclude that this is how the most part I have covered here almost what do you call it as the 65 marks of the portion there in the paper 2, that with the Aushadhi Prayoga Vidyana. And rest other points are remaining points are directly are going to be asked in the examination for either 5 marks or MCQs. Their title itself, for example, what is that? Pharmacovigilance, that is going to be directly going to ask for the 5 marks. And the different dosage forms are going to be asked for the 5 marks. Something like that. Rest of the points which I have left in the second paper are going to be directly as a syllabus point itself are going to be asked for the 5 marks questions. And with this, I wish all the best for the second year the students, so those who are appearing for the examination. And also I thank the Jignasa for Jignasa Karnataka team, for providing me this opportunity to share my the insights in relation with this Ayurvedic Aushadhi Prayoga Vidyana paper 2, the competency-based Ayurveda medical curriculum according to the new LCSM syllabus. Thank you one and all.
Thank you, sir.
If there are any queries, any questions to be asked in concern with the writing examination and all, are welcome. Are there any questions?
No questions, I guess, sir.
Okay.
Thank you, sir. Thank you for conducting a wonderful session, sir. Your expertise and enthusiasm made the topic engaging and it was very useful. We appreciate your dedication and passion for teaching. Thank you once again, sir.